Hi, I'm Fahad Attar, an orthopaedic consultant, subspecialising in lower limb arthroplasty and knee reconstruction surgery.
Mr. Attar works at the BMI Alexandra Hospital, Spire Cheshire, and Spire Manchester Hospitals, and the Wilmslow Hospital. Mr. Attar specialises in hip and knee replacement surgeries and manages sports-related knee injuries. The specialist clinics he runs at these hospitals include Young Adult Knee Arthritis Clinic, Anterior Knee Pain and Patella Instability Clinic, Multi-Ligament Knee Injury Clinic, and the One Stop Knee Clinic. Some of the innovative procedures he performs to improve pain, function, and patient satisfaction include knee resurfacing procedures, meniscal transplant surgery, and patient-specific knee replacements.
Some of the subspecialist clinics we run include managing young patients with arthritis, and management options for those are joint preservation surgery, including osteotomies and meniscal replacement surgeries. Sometimes joint replacement surgeries are not entirely beneficial in that age group. We also deal with a lot of patients with anterior knee pain and patella instability. There's a lot of patients referred across with ongoing problems in this area. When we normally see you, we go through an entire detailed history, find out the relevant procedures and management that has already been undertaken, go through a series of investigations to find out the exact cause for this. This is normally a complex area which involves a lot of different factors which can be involved. Again, we use a patient-centered approach to try and find out what areas and factors are most suitable in your case and any suitable management options that will be relevant to you. Knee replacement surgery has changed the management of knee arthritis in recent years. But despite that, the current state of play with knee replacement surgery shows that there's still 1 in 5 patients who are either unhappy or dissatisfied with the overall outcome of surgery. This can either be due to pain after the operation, or loss of function, or sometimes a combination of both. There are various factors that affect this, and some of these factors are addressed by the patient-specific knee replacement system that we use. But the conformist knee replacements are designed based on patient anatomy. So when you're initially seen in the consultation, you're sent off for a CT scan, and the whole 3D mapping of your knee is sent off for the implants to be made, and these are designed specifically to your anatomy and the patient specific, including instrumentation and the implants themselves. The whole process normally takes about 4 to 6 weeks for the implants to be made and shipped back to us, and when you have a theatre slot organised, they're ready in time for your operation.
Hi, I'm Eve, Mr. Attar's private secretary. I'll be your first point of contact. Mr. Attar and I work very closely to ensure that you get an individual experience with you at the centre to give a patient-centred approach.
The service from Mr. Attar and Mr. Attar's office has been excellent. They've kept in communication, no problem at all with the follow-up appointments. They come through the post. Marvellous. If you've got any problem with the appointment date or time, you just ring them up and it's changed.
Our role is not just divided into a surgeon or an anaesthetist or a nurse. We all complement each other by understanding our role, by also understanding what you go through.
After the surgery, you are actually transferred to the recovery, and until you are discharged, we keep an eye on you and make sure that everything is okay and you are pain-free and you have no medical issues before we send you back to the ward.
Came round in recovery, and the first thing I immediately noticed was, wow, I had no pain in my hip. In the actual hip joint, there was no pain. In the area where they'd worked, it felt numb, as it would. But there was no pain a couple of days later on the ward.
I think the surprise was how quickly the pain went away, and really how much the effort that I made, and the nursing staff and the physiotherapists, and obviously Mr. Attar's skill as a surgeon, how that all came together, and with such a good outcome, really.
He's very, very thorough, and his diagnoses are good. He doesn't act until he's got the full story. I found that with my hip, and he's very very good at explaining things to you in terms that you can understand, but enough medical that you know you can sort of pick up what's going on quite well. And I like to know what's going on, so that was good.
And he always has time for you. You know, you never feel that, oh well, better hurry up, there'll be another patient around the corner. You always feel that he's letting you have the maximum amount of time that's needed.
For 10 years I was static, not able to do anything, can't move forward, having not able to do jobs that I could do before, to be able to do them all now. Yeah, it's given me my life back. I just feel brilliant.
The service has been, to date, since first meeting Mr. Attar to date, it's been excellent. I really cannot fault the whole thing. It's been great, and I hope I don't have to come back for any more treatment, but if I did, I'd certainly be contacting Mr. Attar again.
On my first consultation, I found Mr. Attar very open and, you know, a really good communicator. So it was a real two-way flow of information. And that was quite different from what I'd found with other surgeons in the past. So, you know, that was a big tick in the box for me. And I just found him, you know, really receptive to ideas, putting forward, you know, excellent ideas and things, and you know, it was just really, you know, different and sort of almost pioneering in my, you know, my sort of limited knowledge of the area, really.
I would recommend to use Mr. Attar. He's very personable, very knowledgeable, very caring, and I think you'd be very, very happy with the outcome.
To book an appointment, please call 0161 3933 996 or email fahad.attar@consultantcare.com.